My name is Dr. Gary Lehner. I am the James and Pamela Muzzy Endowed Chair of Molecular Imaging and Therapy at the Hoag Family Cancer Institute and a professor of radiology and translational genomics at the University of Southern California. There are bone scans and then there are PET scans. Bone scans are a type of study which allows us to see specifically the bones and evaluate to see if there are problems in the bones like metastases. A PET scan is a little different than a bone scan in that first it's often done as a combined PET-CT. So the PET scan provides you with metabolic information while the CT provides anatomic information. And secondly, the purpose of the PET scans are different than the bone scans. Whereas the bone scan is only seeing the bone, PET scans are looking to find the cancer cells themselves. FDG PET scan is a metabolic scan. FDG is a sugar molecule that has been tagged with something that allows us to see it. And then we administer the FDG into a vein. It circulates all around the body and finds things that are eating sugar. Cancer cells are often very metabolically active and thus are eating lots of sugar. So an FDG scan can often detect cancer before the cancer can be detected on other imaging modalities. The other type of PET scan is the fluoroestradiol or FES PET scan. The FES PET scan looks for estrogen receptors. Now, about 80% of breast cancer highly expresses estrogen receptors. So for patients who have estrogen receptor negative breast cancer, the FES PET scan will not be valuable. But for patients with estrogen receptor positive breast cancer, the FES PET scan can often provide the most sensitive method of detecting cancer, as well as being very valuable in helping to determine if endocrine therapies will be valuable in an individual patient. The FDG PET scan has many clinical indications where it can be beneficial. It can be valuable in patients at initial diagnosis, in patients who have what's called locally advanced disease, to look for unexpected distant metastases. So in patients with stage 2B to 3C breast cancer, FDG PETs are very valuable for what we call systemic staging, making sure we know where breast cancer is and whether or not it has spread to distant sites. This changes the way patients are managed and helps patients receive the best treatments for their stage of breast cancer. Another area where FDG PET scans can be very beneficial is in looking at response to treatment. The cancer cells, we said, eat sugar, and the FDG is found in cancer cells that are eating sugar. Cancer cells that have been damaged by treatments eat less sugar. So by looking at the level of FDG uptake before a treatment and the level of FDG uptake after a treatment, we can tell if the cancer is decreasing or if it is increasing, and thus determine whether the treatment is effective or not. A third area where FDG PET scans have been found to be valuable is in detecting disease recurrence. In patients who are thought to be have excellent treatment, and there is a concern that the disease has returned, FDG PET scans are the most sensitive scans available for determining whether that disease has indeed returned or not. FES can help determine whether endocrine therapy will be helpful in an individual patient. So as we said with FDG, the FDG can help you determine after you receive the therapy, did the therapy work? The FES PET scan can help predict before you even receive the therapy, is it likely the therapy to work for your cancer or not? A second area that FES PET can be valuable is in lesions that are difficult or dangerous to biopsy. We've had patients where a lesion is in a difficult location where we can't get a needle to it. The FES PET scan can help determine if that is an estrogen receptor expressing breast cancer lesion or not without having to perform a dangerous biopsy. Because there are very few things in the body that express estrogen receptors other than estrogen receptor expressing cancer, if you see a lesion picking up FES on the FES PET scan, that's very strong evidence that that lesion is cancer, even if you don't have biopsy proof. And third, if there are what we call equivocal lesions on another study, for example, FDG PET or CT and bone scan, then the FES PET scan has been shown to be valuable in more definitively determining whether an equivocal lesion is cancer or not. 1 out of 8 women will have breast cancer during their lifetime. So if you're listening to this and dealing with breast cancer, know that you are not alone. Physicians, the Susan Komen Foundation, and many others are here to help you with your journey. I hope that the information that we discussed today on nuclear medicine tests like bone scans and PET scans, which may be valuable for patients with breast cancer, provides you with information that helps you with your journey.